All right, good afternoon, everyone. Thank you for joining us for our town hall event today, focused on the 2022, Vermont open enrollment with Vermont Health Connect. And we have today our guests from Blue Cross Blue Shield of Vermont to present to us specifics about the plan options that they will be offering this year through Vermont Health Connect. Couple pieces of housekeeping information. I want to let everyone know that they are welcome to post questions in the Q&A, and that icon can be found with a little question mark on your Teams platform. You can type those questions into the chat box, and we will be sure to try and get those questions to our presenters for them to answer in this series. This video will also be posted online at our Vermont Health Connect website, and so that way folks can access the information discussed today at a later date if you want to pass that on to your friends, family, colleagues, excuse me, whoever may be interested. So without further ado, I will introduce Jordan Benson, who is coming to us representing Blue Cross today, and he's going to talk about Blue Cross's plan options for 2022. So Jordan, I will turn it over to you.
All right, great. Thanks, Zach. All right, so thanks for everyone attending today. My name is Jordan Benson. I'm one of the consultants here at Blue Cross Blue Shield of Vermont. So we'll talk about essentially what plans we are offering Vermonters for 2022, as well as the highlighted programs that we offer our members if they choose Blue Cross coverage. So as I mentioned, we'll talk about the plans and then also the benefits that members receive by selecting Blue Cross. All right, so if you are familiar with the Vermont marketplace or with the products that Blue Cross offers, either you're a member currently or you've been a member in the past. So here are just what has remained the same for 2022. So again, Blue Cross Blue Shield of Vermont, we are located here in Vermont. So our employees are serving fellow Vermonters. We do have the same plans available for 2022 that we had in 2021. Again, Vermonters can purchase qualified health plans either through Blue Cross directly or through Vermont Health Connect to receive financial assistance. And then with our products, we do offer an extensive Blue Cross Blue Shield EPO network plans that allow coverage within Vermont as well as across the country. So some of the big changes for 2022 is that this is the first open enrollment period with the expanded subsidies that were approved last March of 2021 due to the American Rescue Plan Act. So Vermonters are now able to receive subsidies to help reduce their monthly premiums that they may not have received in the years past when selecting a plan during open enrollment. As well as open enrollment has been extended by the federal government until January 15th, 2022. And in the past, Vermont Health Connect purchasers were paying their premiums directly to Vermont Health Connect, even though they may have selected Blue Cross coverage. One of the big changes is that starting January 1st, those marketplace purchasers through Vermont Health Connect will be paying the carriers directly for their monthly premiums. And then with our ID cards starting for 2022 coverage, they will display the plan's deductibles, co-pays, and out-of-pocket limits based on the plans that the members choose. So with Blue Cross Blue Shield of Vermont through Vermont Health Connect or Blue Cross directly, we have 14 different plans that we offer. One plan is eligibility required, and that is our catastrophic plan. But with the 3 other different product types, our Vermont Preferred, Vermont Select, also known as non-standard plans. So these are the plans that Blue Cross has created and slightly changed from those standardized plans that has been approved by the state of Vermont. One of the things is that these are based on metal levels, the plans. So depending on the metal level, you have different deductibles, co-pays, out-of-pocket limits within those metal levels. Next slide, thanks. So with our plans, we offer 2 different types of products. We have, with the deductible and out-of-pocket limit, we have a stacked type plan as well as an aggregate plan. With our stacked, if you're on a family plan or a 2-person policy, essentially there's an individual limit that one of your family members could meet, as well as all the entire family members accumulate towards a family deductible. An aggregate plan, your entire family shares the cost. So essentially you are all accumulating your medical services into one shared common deductible and out-of-pocket limit. So one of our unique product offering is our Vermont Preferred plans. Within our Vermont Preferred plans, we do offer a 369 combined doctor office visit benefit. So the number of visits between 3, 6, or 9 is based on the number of people enrolled on your plan. So an individual only is 3 visits, a couple plan is 6, and a family of 3 or more are 9 visits. With these plans, you would have those total number of visits with either a primary care physician, a mental health provider, or a substance abuse counselor at no cost to you as the member before you meet the deductible that's required on the plan. As well as we provide additional no-cost visits for select chronic care services for our members that have been diagnosed with diabetes or heart disease. So it'd be 3 visits per member that with various specialists at no cost to you. As well, with our Vermont Preferred plans, we have our select wellness drugs, which are some of the examples are provided there, where the deductible is waived on the plan for those type medications, and you have applicable cost share, copay, or co-insurance based on the different tier. So the next few slides are just quick, are the layouts of the plans. This information can be located on our website with our plan chart, as well as Vermont Health Connect's plan comparison tool, or our new enhanced shopping tool that we have available for our members or viewers. So this just, the next few slides just explains what the plan is, what the deductible, copays, and your cost sharing would be on the plan. As well as it provides you the eligible type services that are included. But for a more complete listing, the summary benefits for each plan would provide you more details about other services. With our Vermont Select plans, they're considered like high deductible health plans. So the nice thing about these type plans is that you have the same deductible and out of pocket. You don't have to worry about co-insurance on the plan. So co-insurance is essentially the shared percentage that Blue Cross and you as the member would pay after you reach a certain deductible. But with these plans, once you meet the deductible and out of pocket, which are the same, then you're fully covered at 100% for the rest of the year. So you don't have to worry about, do I pay 25% of this service? Do I pay 50%? You just pay the first deductible amount, and then you're covered at 100%. So the standard plans are the standardized plans in the state of Vermont. So a lot of these plans allow copays for office visits prior to meeting any deductible. So your primary care, chiropractic, physical therapy specialists, even urgent care. With these plans, you have those copays prior to meeting any deductible, as well as generic medications. So again, these are standardized, but these are the plans that Blue Cross is offering through the exchange for the standard. And then just the catastrophic plan, again, it is eligibility required. The most common eligibility requirement is that someone has to be under the age of 30 at the time of the enrollment. It's more of an introductory plan for those new to health coverage. Either they're under the age of 30, their subsidy doesn't provide them enough money to help reduce a monthly cost towards a gold or a platinum, or silver. So this is a low cost option for those that are new to health coverage under the age of 30. So next we'll go into some of the benefits that you members would receive by selecting Blue Cross coverage. So as I mentioned previously, with all of our plans, we have our EPO network. With Blue Cross Blue Shield, which is a association network throughout the United States, you're able to have services across Vermont, across Vermont as well as across other states with any Blue Cross Blue Shield preferred provider. So if you have children that are students outside the state going to different universities, or if you travel, you would have coverage available with any of these plans outside the state. So with our pharmacy benefits through Vermont Blue RX, we have 3 different medication tiers: generic, preferred, and non-preferred brand medications, as well as it provides you select wellness drugs, which our deductible is waived for our Vermont preferred, as well as any of our consumer directed health plans, also CDHP. One of the nice things is that we have an interactive formulary that's available on our website, where you're able to search your medication and it will input what tier that medication is on. So you don't have to worry about searching a comprehensive formulary. You're able to enter that medication right on our website, and it will tell you what tier the medication is covered on based on our plans. As well as, so with COVID, telemedicine services have become popular over the last 2 years. So with our benefits, we do partner with Amwell to offer a telemedicine services to our members, which are available 24/7. They're private and secure, convenient, on-demand medical care for face-to-face services with licensed providers. You can use either a computer, tablet, or smartphone to have those services. No appointments are required. So examples of services that are included in this benefit are sick visits, behavioral health, nutritional counseling, and lactation support. As well as Blue Cross Blue Shield Vermont, we provide health and wellness resources to our members. So with any of our 13 plans, we provide preventive benefits at no cost to our members prior to meeting any deductible, copay, or out-of-pocket limit on the plan, as well as for any member under the age of 21, there is pediatric dental and vision coverage included in these plans. With that benefit, the costs do accumulate towards the deductible and out-of-pocket limit on the plan, rather than paying completely out of pocket for those child services. As well as we provide a health and wellness platform to our members. We have an expansive integrated care management program. For expectant mothers, we have a Better Beginnings program that allows discounts for various services, as well as newborn material. As well as we have Blue Extras program, which any of our members are able to participate with vendors within the state of Vermont for wellness discounts. So for example, we have a few acupuncture vendors where you may get a discount for a membership or per service. So a complete listing of our Blue Extras program is available on our website. So if you with being covered by Blue Cross Blue Shield Vermont, our members have access to a member portal, which you can review your benefits, your claims, as well as a historical claim summary. We also have a cost comparison tool that you're able to compare costs for various services between different providers. You'll have access to a pharmacy center through our Vermont Blue RX pharmacy program, access to a Find a Doctor tool, as well as the other additional links, Amwell Health and Wellness Platform, and our consumer-directed health plans are eligible for a health savings account for consumer-directed health plans, and we do have an integrated product called My Money that's available to you as well. Blue Cross Blue Shield Vermont, we actually just launched a new website. So that is bluecrossvt.org, where you're able to access our qualified health plan information for individuals and families, our chart, summary of benefits for each plan. As I mentioned, we do have a new Find a Plan shopping tool and the certificates of coverage, as well as if you are looking to enroll with Blue Cross Blue Shield Vermont directly, because you do not qualify for any of those expanded subsidies, you can certainly apply on our website for that direct enrollment as well. So if you have any questions, we're here to help. You can contact us by phone or email. We are available for open enrollment Monday through Friday, 8 to 6. As well as we'll be available on select Saturdays from 9 to 12. So if you have any questions about plan details, enrollment questions, or you want to discuss your subsidy eligibility, give us a call. We'll be able to walk you through all the plans as well as your eligibility for those expanded subsidies to help reduce your monthly premium cost. And I think that is the last slide. So that is our presentation for Blue Cross Blue Shield Vermont. Again, if you have any questions, certainly post those and we'll be able to answer throughout the presentation.
Thanks, Jordan. Really appreciate the presentation and hopefully our attendees have found that helpful. Again, you can post your questions in the Q&A box here on our Teams platform, and we will get those questions to Jordan. But there's also resources here where you can call, like Jordan mentioned, or email if you have questions after the fact. Please feel free to share this information widely. This is one of our many efforts to communicate the important opportunities and information about open enrollment this year, and in part of our series of town halls. So just want to thank Jordan for helping communicate that message. Jordan, we do have one question. It looks like a couple questions actually. So I'm going to start with this one. I'm working with a client who's transitioning and has inquired about the cost coverage of such procedures and medications. I see testosterone as tier 1. However, can you comment on the average costs of testosterone and also if other procedures for transitioning are covered?
So unfortunately, I wouldn't be able to provide exact specifics on the cost. If you are currently a member with Blue Cross, I would certainly refer this client or have a conference call with our customer service team, and they can provide more detailed information. From my understanding, the transitioning benefit, it is eligible for coverage. There may be certain prior authorization requirements, but our customer service team would be able to provide more detailed specific and answer any of those specific questions you may have.
Thanks, Jordan. So it sounds like, yeah, for any kind of very specific customer questions, it's really, I know that at Vermont Health Connect, we always say, we can definitely provide you the guidelines and the general information, but it's, for the specific scenarios, it's always good to call and talk to someone to make sure that it applies to your plan and applies to your situation. So I'm going to give folks another moment or two to post questions, but again, this is generally designed for folks to share and spread the word about what Blue Cross has to offer. This is part of the series, so if there's information that you didn't hear in this presentation about general health insurance information or terminology or how it all works, you can join one of our other town hall sessions or join us online and find resources at our website. Okay, so Jordan, I think that that's all the questions we have today, and thank you again for joining us and making this presentation, and thanks for all the attendees who participated in the question. And until the next one, we will be having another town hall this coming Friday, and stay tuned for information about that on our website and our social media. Take care.